The Autoimmune Connection is a web series dedicated to all things autoimmune, with hosts Christina Feindel of A Clean Plate, Emma King of The Bacon Mum, Kate J. of Healing Family Eats, and Rory Linehan of The Paleo PI, interviewing new guests every episode. We're bringing patients, practitioners, friends, and family together to connect the dots between diet, lifestyle, and autoimmune disease.
Hi everyone, I'm Emma King, I'm the Bacon Mum, and I am your host this week on the Autoimmune Connection. And this week I have the pleasure of Anne Angelone joining me today to talk about the subject of leaky gut and what is a leaky gut. Anne, hi and welcome.
Hello Emma, thank you for having me.
Yeah, so Anne, it's a pleasure to have you with us this week. And you are very well known in paleo circles, but for those people who don't know you, perhaps you'd like to introduce yourself.
Sure, yeah. My name's Anne Angelone. I'm a licensed acupuncturist and herbalist, and I practice in San Francisco. I also have studied with Dr. Datis Karassian, so I do a lot of functional medicine in my practice and use paleo nutrition also to figure out the best dietary template for all of my patients. So I do that as my local practice, and then I also consult with the Paleo Mom consulting team. So I do functional medicine consulting on that team as well. And that's done mainly by Skype. Some people do come in locally for that, but mainly by Skype.
Excellent. And I just completed your Test Clear Heal program, which I found so insightful and helpful for me to understand my own body and also empower me to assist me in speaking with my own doctors. Could you speak to that program?
Sure, yeah, thanks so much for taking it and saying that about it. I did it because I really wanted people to be able to have those kind of tools to be able to do this themselves sooner than later, and the truth is that you can do these tests now. These are available to most people, both locally in the United States and internationally, although not every state, but you know that program was trying to give people access to the tests that they can order, some of the functional medicine tests, without having to go through a functional medicine practitioner first thing, so that they can start reading and understanding their own tests and be able to monitor their health even before they see a practitioner or in conjunction with seeing their practitioner, so that they can be as on board as their practitioner is regarding their own health.
Right. Yeah, I mean, I found it incredibly powerful, and it really prompted me to want to do this session with you, because as I was in that program, it became very evident to me that despite, you know, all of the efforts and work that I've done, that I'm still struggling with a leaky gut. And I know that there are a number of different influences that can contribute to that. So, and perhaps you could tell us first, what does the term leaky gut actually mean?
Sure. Okay, so I think it's like a very great provocative term now. I think becoming a more like household term, actually, because people are starting to realize the connection between leaky gut and autoimmune disease and a lot of chronic diseases. But what it means is that in the small intestine, we're looking at how the tight junctions open and close, and that's supposed to be very tightly regulated by the cells of the small intestine. And it's the area that opens and closes called the tight junctions. And so what we know is that certain foods and bacteria and viruses and things can actually, stress can actually open and close those junctions more so than what should usually be happening for normal transport of nutrients. So now if those junctions are more open, then say undigested food particles or bacteria or yeast or whatever can get through to systemic circulation, and so now the immune system has a chance to basically tag those foreign antigens or these foreign proteins and create an immune response. So that's why it's really key to look at and be able to see, like, okay, how do I heal this up? Because then you're going to really decrease a lot of the what we call extra-intestinal manifestations, so in the joint tissue or, you know, in the skin or the brain.
So is it that, you know, when those particles leak into the bloodstream, that the immune system sees those food particles as being foreigners, but then it also sees the white blood cells because they mimic the food particles as being foreign? Is that what leaky gut? Well, is that what kind of happens for the autoimmune disease to happen?
Yeah, I think, okay, so I think breaking it down, essentially the adaptive immune system is the part of the immune system that's going to respond to the foreign antigens. And once that happens, that's like, imagine like this immune response is like an inflammatory response. And so now you have this like, not only inflammation, but also the tagging part of the immune system can tag other tissue. And so the immune system sees that tissue as foreign as well. So that's called molecular mimicry and can start attacking that tissue. So that's where it gets precarious for people who have any tendency to autoimmune disease, because then those tissues can be attacked.
Right, right. And so, I mean, that's obviously how, you know, autoimmune disease starts. And is leaky gut the root cause for autoimmune disease?
Well, okay, so it's not necessarily a root cause, but it's a predisposing factor. So this is where Alessio Fasano, who is a researcher in the area of celiac disease and gluten sensitivity, came forward and said, hey, this is one of the predisposing factors. So we knew about genetic tendencies, right? We knew about environmental triggers, but we didn't necessarily know that there had to be like a breach. How do those two things interact? Like if I have a genetic predisposition and I'm eating gluten, how is that going to really trigger a response? It's through a breached barrier system. So in this case, intestinal permeability, but we're also looking at other barrier systems like the lungs, you know, so everything that basically is going through to get an immune response from the body, because we have to protect the host, right? And so the host has to like discriminate between what's foreign and what should actually be beneficial for our system. So to kind of regulate that, we need to have a very discerning immune system. But if the barrier, say, of the lungs or the gut are not working well, then you have that constant interaction between environmental trigger and genetic predisposition. You know, and then Sarah Ballantyne came along with her research also, and noting that there are a lot of nutrient deficiencies across the board that, one, can not only be caused by leaky gut, but it can also predispose you to a leaky gut. So these are the factors that we're looking at that contribute to autoimmune disease.
So, and you know, are we seeing families of people suffering from autoimmune disease, you know, because of that genetic predisposition?
Yeah, absolutely. I think that's there, and then also I think we're learning so much more about even leaky gut genes, like some of the predispositions there. So, you know, those tendencies, and then what kind of diet, like, how is the disease actually getting triggered? Right, so you can have the predispositions, you know, for any number of diseases, right? But if it's not triggered, then you might not be expressing this disease. So this is the whole piece of like, yeah, if you know that you have the predisposition, likely other people in your family have that predisposition, but it's a matter of now environmental triggers and how well somebody is constitutionally apt to respond.
How can you test for leaky gut? Is there a test that you can go to the doctor and say, hey, can I have this test?
Yeah, there are two tests that you could do, and one of them is an older test. It's called the lactulose mannitol test, where you drink those sugars, and then you see over time, doing a urine sample, how well you could absorb those sugars. And so that test is more about absorption, and then there's another test that Cyrex does called ARI number 2, which is looking at more of the antibody response to the cells that are involved right there in the tight junctions, essentially. So you could see through that test if those cells are, if you're basically creating an immune response to those cells, which would show that those were active and involved. And then also that test will give you an indication of whether or not there's dysbiosis, and also an antibody response showing that there was a breach in the barrier, because you get lipopolysaccharide antibodies showing up on that test as well. So those two tests are the ones that are available. And then the other self-test that you can do would be basically to do something like the autoimmune protocol for a number, like probably a number of months before you start reintroducing, especially if you have a severe autoimmune presentation or chronic disease expression, where you really want to start noticing some results first.
Okay, and you say stay on, the diet for some time. I think a lot of people think, well, if I do the elimination diet for 30 days, I should be healed, and
Right.
now I can start reintroductions. If leaky gut exists, how quickly could a leaky gut heal?
Right. Okay. So that's a really great question. I think what happens to a lot of people, they get very excited about the autoimmune protocol, and I think we should be, because it is the most advanced anti-inflammatory diet on the planet. But the truth is that I think the big sort of newsflash for people is that they actually have intestinal dysbiosis, which contributes to leaky gut. So you can do anti-inflammatory diet, but it might not necessarily be strong enough, say, to clear yeast and bacteria, parasites, things like this, that people still would need to investigate that are causing or contributing to leaky gut. And not only that, but also obviously like stress and other lifestyle factors, especially managing stress and sleep.
So, my own experience has been that, I started a year ago. In fact, this March was my 1-year anniversary for AIP, and I've had phenomenal results in doing the diet. But what I found was that it kind of peeled the layer of, it reduced the inflammation for me to then see other issues such as the leaky gut that I was dealing with. So it's kind of like it opened more doors, opened more windows with regards to other contributing factors.
Right.
So what other conditions could a leaky gut then contribute to?
Right. Okay. So you mean besides autoimmune?
Right.
So, yeah. Okay. So I think everyone with a chronic disease should look into healing up a leaky gut and considering perhaps what nutrient deficiencies are causing it, what medications they're taking are causing it, what foods that they're eating are causing it. So things like chronic fatigue and depression and even like cardiovascular disease and diabetes, things like that are associated with leaky gut. So, any case of chronic disease now we're finding, because the thing is that the immune system is mostly contained in the gut-associated lymphoid tissue. It's like 80% of our immune system. So it's like this big thing that everyone's starting to get in the know about, that it's essential to keep it healthy.
And there's been a lot of really valuable information, on the internet and in the press recently about the connection between the gut and the brain.
Yes.
And obviously, I see this in myself, and I think I see a trend out there as well, that a lot of people, if they have a leaky gut, then, it's also going to give them maybe brain fog and, other sort of depression and other sort of brain dysfunction. Could you speak to that too?
Sure. Yeah, I think what happens is through what's called the cytokines, which are the inflammatory cells of the immune system, those can cross the blood-brain barrier. And what happens then is that the microglia, which are the immune cells of the brain, they start being inflamed, and so that causes basically like it decreases neuronal transmission. Right, so people start thinking less clearly, they feel depressed, have brain fog, this kind of idea of like there's just less oxygenation to the brain and much more inflammation. And the truth is that can last a while. You really have to work with, using botanicals and flavonoids, things that actually decrease that kind of inflammation in the microglia, So obviously the root is to treat the gut, because you want to decrease any of the inflammation that's coming from there that would make the cytokines react and go and, stimulate the microglia. So, but along the way, there's also stuff you can do to quench the inflammation in the brain, in the microglia.
And I saw myself that in the first 3 to 6 months of me being on the AIP, I didn't reintroduce any foods at that point. But after the 3 months, that's when I really started to notice the brain fog lifting, and we beginning to feel far more balanced, both emotionally and mentally.
Right. Yeah. Because again, like if more balanced emotionally, right? So basically, you're looking at better neurotransmitter function, right? Because there's better brain function, better clarity, because there's decreased inflammation.
So if you can speak to how the diet, and I also heard a key word there, lifestyle, right?
Yes.
How does diet and lifestyle help the leaky gut?
Okay, so to start out, I think the AIP is the best diet to do, because right away it takes out the major contributors to leaky gut that are dietary, obviously. So mainly like grains and legumes and even the nightshades. So the main proteins that can contribute to a leaky gut: prolamins, the saponins, and the agglutinins, and those are in grains and legumes and nightshades. So those are the ones that you just completely are eliminating with the AIP. So you're getting off of those, and a lot of the sugary, starchy crap that would also contribute to, say, promoting like more yeast or bacteria. That's all out, right? So that can be really helpful, and that's why that works. But like, say for example, the lifestyle piece, like, so somebody's doing all that, they're great on their diet, but their sleep is terrible, and they are overworked, and they haven't really dealt with an exercise program or meditation or been able to squeeze in any stress management. So that can be, excuse me, that can be just as like harmful as somebody eating gluten, in its way, because essentially stress increases cortisol, and cortisol can contribute to a leaky gut in the same way that, for example, some other trigger like gluten can increase the production of zonulin, which opens up the tight junctions. So there are different mechanisms, but all contribute to a leaky gut.
Wow, I mean, it really is that conundrum, isn't it? It's the balance. It's knowing which balance, and it underlines the bio-individuality of us all in relation to what works for one isn't necessarily going to work for another. So when it comes to reintroduction, someone's been on a diet for, on the diet for say 30 days, and they're thinking, okay, now it's time to reintroduce. Are you more likely to have a flare if your leaky gut isn't completely healed? How quickly should you be thinking about reintroductions?
Oh, that's a great question, actually. Yeah. So if you still have a leaky gut, then you probably would be more predisposed to having some sort of flare, right? Because those proteins, say, are just too much for your delicate gut. So if you're only on it for 30 days and you start reintroducing, you have a flare, obviously it's going to be an indication to be on this longer. So I have brought up before that it is a rule of thumb in natural healing. This is like not set in stone. There's probably no research on this, but I say to my own patients, like, give yourself 1 month per year that you've had autoimmune disease expression, right? Obviously, like, for a disease expression to start occurring even before tissue destruction, we know that there's probably a leaky gut component there. So you start it from the time you first had symptoms, not from the time you had a diagnosis. So, say you started having symptoms at age 20, but by the age of 25 you got your diagnosis. Go back to age 20. Now we've got 5 years, but now you're 30 and you have you have diagnosis now, but now you have this 10-year period, and now you're just starting the autoimmune protocol. Boom. Right. So you have 10 months now to consider of time to give yourself to really heal, because what you're going to be doing is you're going to be getting off the inflammatory foods, putting in the stuff that heals, right? And then figuring out along the way, if that's not enough, okay, I've got to check out dysbiosis, or I've got to check out my adrenals, or I've got to really work on my stress, or wow, my hormones are really low and imbalanced. I really need to see my doctor regarding that. So there are a number of things that you can do to actually build your body up to heal sooner. But that's really the template I give people, like give yourself a month per year. So your question is like, if I still have a leaky gut, would I have an immune response, right? And I think yes, And then was there another part to the question too?
Well, I mean, actually, in your answer, I have another question.
Okay.
Is you refer to putting other stuff in order to help it. So that kind of pushes me towards the question of supplements.
Sure.
So what supplements should you be looking at using when you're healing a leaky gut? And are they like the bio individuality we were speaking about before? Is it a blanket recommendation, or is everybody individual?
Yeah, I think everyone is individual. For example, so I'll name some of the things that can be helpful. So we're looking at, say, zinc, vitamin A, vitamin C, vitamin E, vitamin D, all of those things. Glutamine, L-glutamine's in there as well. So say that's like the blanket recipe. Like people should be taking that set of supplements. But I don't necessarily, for example, give everyone L-glutamine, because that can be a fuel for yeast. So I don't necessarily do that right away to help heal up people's guts.
Right.
But I will recommend, and that's why I think AIP is so wonderful, because it's really saying, hey, let's build up your nutrition, get all of those particular vitamins taken care of, and minerals taken care of, and cofactors taken care of, with diet. So getting your omega-3 fats, getting your from fish, getting your zinc, say from oysters or whatever, has high nutrient density for all those different things, right? So that you can shore up your system naturally before you actually even need the supplements.
And I think that's what a lot of people focus on. They focus on what they've eliminated and not what they should be adding into their diet. So the importance of the nutrient-dense foods and the bone broths, and the organ meats and that side of thing is really where you're getting those additional supplements, not in tablet form, but in food form, to nourish the body.
Yeah, those are probably the most powerful foods that you can consider, as part of this protocol to be able to heal, just short of taking supplements,
Yeah. So, when you touch on the lifestyle, often stress can come from moving onto a diet, like this, where, you're having to balance cooking food for your family that perhaps don't want to eat the way you're eating.
Sure.
How do you recommend to your clients to manage that piece of stress?
Oh, like how to cook for everyone? Is that what you're saying?
Yeah. So often it can be, stressful to start the diet, to actually heal your leaky gut.
I think that, there's a lot of emphasis put on the things that we can't eat, and so it makes it seem like the diet's so different. But every time I cook for my family or my friends, they don't really even notice. Like if I didn't tell them it was AIP, they would not notice, and they would just probably think like, holy wow, this is a great meal. So I think partly just just still making what you're eating for everyone else, and then I think it's important for if you feel like you're actually restricting, say, your kids from carbs or whatever, to have a little extra of that, what they can tolerate, say it's rice or whatever, to have those things, or some snacks that they're used to as well. Don't restrict them completely. But I think as far as huge meals that you're making, like dinners, and maybe breakfast for the family, you could probably get away with cooking AIP.
Right.
Maybe leaving the snacks and some of the other extras there if they can tolerate them.
Yeah. I mean, for me, anyone who comes into my home eats the way I eat and eats the way the family eats. And I have to say, just the same as you, you know, people come here and they say, wow, can I have the recipe for that? That was fantastic.
Exactly.
Like, yeah, I mean, it's really about, you know, spending that time to find those recipes that you like, which then become the regular family staple foods.
Right. Likes. Yep.
Absolutely. So, Anne, anything you would like to add? You know, I've gone through the questions I wanted to ask you. Is there anything else that you would add in relation to managing the leaky gut before we wrap up?
Yeah. Okay. So, you know, I think that you will start noticing that you're healing when your symptoms are starting to subside. And if you're feeling like you're not making progress, I think it's definitely time to investigate further. You know, and sometimes people actually need a little push in that direction or guidance in terms of like what tests would they consider ordering, where to get those tests, etc. So at that point, you could either do my program or work with a practitioner to be able to figure that out. But it does take some time, and we're always pretty much subject to having to deal with the leaky gut because stress is like not going to end, you know. But there's a lot of things within our control, like what we're breathing in, what we're putting into our bodies, that can really be tailored and, you know, go a long way to preventing leaky gut.
Yeah, so if for those of you who don't have, and there's only one of you, so I'm sure that you're very busy, you know, who else could people go to in order to get those tests done?
Okay, so yeah, anybody who, pretty much anyone who's doing functional medicine would know about those tests, but for Cyrex, you do have to be a licensed practitioner and have an account with them. So that's not a test that you can necessarily get through direct labs, where I put a lot of my other functional medicine tests where people can order those, but not Cyrex labs. You actually have to go through a practitioner who has a license and has an account with them to get the ARI number 2 test. So the Paleo Physicians Network and the Institute of Functional Medicine, all of those sites would be really good resources for people.
Wonderful, wonderful. And I would like to thank you for your in-depth knowledge today. It's always a pleasure to speak to you. My knowledge always increases rapidly whenever I have that opportunity, and I hope we've done the same for our listeners today. So thank you so much for your time.
Thank you, Emma. Thanks for having me.